Assalamu alaikum, peace be to you all. Omar here, health educator, family man, distance athlete, and physician assistant. So I wanted to talk briefly and give my thoughts about this Alex Murdaugh case. Of course, if you've been following the news, he is the now infamous third or fourth generation successful attorney who has been found guilty of murdering his son, affectionately known as Paul, and his wife, and also found guilty of stealing a lot of money from a lot of people, millions of dollars. And I won't go into the details of the case. You can look it up. It's all over YouTube. The premise of his initial, monetary theft and misdeeds all started with him supposedly being addicted to opioids, specifically oxycodone and OxyContin. Now, I always think about these things as a healthcare provider is able to write prescriptions, specifically as a physician assistant. We're able to write for controlled substances. That's what oxycodone and OxyContin, things like Percocet and Tramadol are. Now, I think Trump said, during the Trump administration, he declared an opioid crisis. It's not particularly new, but a lot more scrutiny came on providers like myself who are able to write for these types of medications, narcotics. And I remember when physician assistants first got the right or the privilege to write for controlled substances. I've been a PA since 2000, and I was kind of like, when it happened, I was like, yeah, yay us. But like all things, I look at things with potential caveats. I said, well, now we've gotten this privilege, but there's also accountability for that, And sure enough, some PAs unfortunately abused it. There was a husband and wife team that were both PAs that were selling narcotics, and the law enforcement raided their home. They had boxes and bags of cash, and I mean, it was really embarrassing. It was a really bad look for our profession, because I think we got to be ethical and moral as clinicians. So anyhow, I wonder where where this is going to go. If families start suing Murdaugh, because he's still got a lot of debt to pay, even though he's been issued. He's going to basically tantamount out to a life sentence. He's probably going to die in prison, but people are never going to get their money back. But I wonder if this is going to lead to the investigation to certain clinicians who initially wrote the prescription for Alex Murdaugh to even get the narcotics. It had to come from someplace. I've had patients who have told me that they get their stuff, quote unquote, meaning their Percocet or whatever, from the street. Well, you can't get it without a prescription. You can buy it, off the street once somebody else has it and they're selling it. But it's not readily available to the public. Somebody has got to write the prescription for it. I have what's called the DEA number. It's a Drug Enforcement Act. There's also, before you get that, you got to have a CDS number. That's a controlled substance number. That gives you the ability to write for these prescriptions. And it's tracked. So if I write for a prescription, let's say I write for oxycodone for somebody, and I give a limited supply, and then that person, I never give refills, but that person goes to another pharmacy and tries to get some more, and they say, well, wait a minute, because we got electronic medical records now, the pharmacist will say, wait a minute, you already had your prescription for oxycodone filled last week. You should be done with it. And now you're trying to get more? I've had patients, forge doctors' signatures and try to get, somehow they got their hands on a prescription. And that's another caveat for you guys that are up and coming young PAs. If you're still in an area where the doctors are using prescription pads, it has your name on it also, be wary, be very protective of those pads and those prescription pads, because it's a hot commodity on the street. I didn't know this. So I've had patients, threaten to beat me up, threaten to kill me. Actually, I learned about a doctor that was shot in the head by the husband of one of his patients because he wouldn't refill her narcotic prescription. So the husband came and shot him. So I wonder, and on that note, I've had family members of some of my patients ask me, hey, yeah, I'm in pain too. I was wondering if you could fill a prescription for me. It's like, no, absolutely not. No, you're not even my patient. Are you crazy? You got to be very, very careful. And hopefully you'll work in a place where, whether it's a hospital or doctor's office or a practice, where they already have a pre-established narcotics agreement or some type of policy that they enforce. So like our place is like, well, you can't just come get narcotics willy-nilly like TikToks. If you get them, you'll get a very limited supply, like a 3-day supply, and it will be tracked, and we will refer you to pain management, because the pain management specialists, I find that they have different techniques that which I'm not particularly trained in terms of efficiently managing people's chronic pain. And that's not to disparage anybody with chronic pain issues. I've had patients who are in palliative care. That's where the patient is actively dying. They've got end-stage cancer and they're in pain. They're usually in hospital or they're at home receiving palliative care. That's a different scenario. But people say, well, I've got really bad headaches, or I've got a bad back. I need pain medication. So I said, well, look, you got to take ibuprofen or extra strength Tylenol. Oh, it doesn't work for me. Well, what do you want me to give you? Percocet. No, I'm not giving you. That we've got pain skills that we use in medicine to try to effectively quantify and qualify people's pain. And then we'll do ancillary studies, like if you say, had a guy literally threatened to beat me up because I wouldn't give him what he needed, in his words, to manage his pain. So I had an x-ray done on him. He did have some degenerative joint disease. And it wasn't just him, it was a few patients I've had like that. But I said, listen, you're well over 50. Many of us have got some degree of degenerative joint disease. I'm not going to give you what you're asking for. I will refer you to a pain management specialist or an orthopedic specialist who can effectively manage your pain much better than me. I'll give you something to kind of tide you over, maybe a limited supply of extra strength Tylenol, something like that. But you have to be very careful, especially to my fellow PAs, and understand that whatever you do affects your supervising physician. So you got to make sure it's okay with your supervising physician for you to write for controlled substances, and that's usually in the physician PA licensing agreement or delegation agreement. You don't want to get yourself in trouble, and then you don't want the Alex Murdaughs of the world, getting their hands on multiple doses of narcotics, and then coming around and essentially, absolving themselves of any accountability and saying, oh, well, I did this because I was hooked on narcotics. I was hooked on opioids. That's one of the more innocuous things to be addicted to, because you're able to kind of pass the proverbial buck to, on the prescribing clinicians, instead of, society is very harsh on heroin addicts and crack addicts, but when it comes to opioid addicts, it's like, oh, well, your doctor got you hooked on opioids. It's terrible, terrible people. So just be careful. And what are your thoughts about this Alec Murdaugh case and his addiction to opioids? And those of you all who may be nurse practitioners, medical doctors, and PAs now or in the future, what do you think are some things we could do to better control for the unregulated acquisition and use of narcotics? That's it for now. I wish you guys the best of success in your positive endeavors. You can reach out to me if you need shadowing opportunities for pre-PA students. Take care. Peace.